Hi, my name is Cindy Robinson, and this is a PowerPoint on diabetes. If you will, first take my pretest before we continue. Diabetes is a condition in which the body either cannot respond to or produce insulin. This causes an elevation in glucose or blood sugar in the urine and blood. Insulin is a hormone produced by the pancreas. Insulin facilitates passage of glucose into cells of the body, which is then used for energy. There are two types of diabetes. Type 1, which is rare, approximately less than 200,000 per year are diagnosed, and it appears during the adolescent years. Cells in the pancreas do not produce insulin, and there is no cure. Symptoms of type 1 can include fatigue, hunger, thirst, blurred vision, frequent urination, weight loss, and sweating. Type 2 appears in the older years, in adulthood. It's a common condition in which the body can resist or does not produce insulin. With type 2, there is a possibility of remission with good diet and exercise, but it can be lifelong. Symptoms are fatigue, frequent urination, excessive thirst, blurred vision, excessive hunger. This is a very common condition in the nursing home community. According to the National Nursing Home Survey, approximately 15% of nursing home patients are diabetic. Most who are diabetics are insulin dependent, requiring frequent, in many cases multiple times a day, blood sugar checks. Vigilance is a must in these cases. Results of inadequate care for these patients include nerve damage, which includes amputation, kidney damage, failure, heart disease, blindness, stroke, coma, and even death. The key is being vigilant and proactive in this community. This is especially true in the nursing home. There are some comorbidities that can increase exacerbation: Alzheimer's, dementia, immobility, cancer, high blood pressure, heart disease. Patients with these pre-existing conditions may not recognize symptoms normally associated. Alzheimer's patients probably won't remember to tell you or remind you to check their sugar. Not being vigilant can cause a busy nurse to forget checks. This can prove deadly. Nurses in the nursing home typically have many more patients than a hospital setting, sometimes as many as 40 at a time. In the sometimes chaotic environment of a long-term facility, the nurses need a system of checks and balances. This must go beyond the medication administration record. Care for these patients include finger sticks, injections, medications, meal planning, and the nurse must delegate someone specifically to check blood sugars. This person must have computer access or a list that gives patients names and all specific check times. There needs to be periodic meetings related specifically to caring for these patients, knowing what and when to report, systems of a crisis, and consequences of mistakes. Those with diabetes must be aware of all the diabetes patients. Kitchen staff can make mistakes. Family may sneak snacks in. Other patients may give foods to diabetics. Meticulous skincare assessments are a must. These need to be done in no less than once a week or on each diabetic patient. These patients can lose sensation in their extremities and be unaware of wounds. If not treated, infection develops and chaos ensues. These wounds can develop rapidly, and foot care must be done by someone with knowledge of diabetic foot care, such as trimming nails. It is important to include diabetic patients in their plan of care if possible. Giving them food choices can improve their chance of eating a well-balanced diet. Malnutrition can complicate diabetes. Knowing a patient's blood baseline can prevent ensuing problems. Knowing individual treatment plans in the event of an emergency or know where and how to access that information immediately can help. Make improvements on and implement new protocol. This is a new plan. At the beginning of the shift, all charge nurses need to prepare individual emergency treatments and put in allocated space, clearly labeled with name and any necessary instructions. The nurse then needs to check expiration dates on the insulin and promptly discard all expired insulin vials and pens. The nurse needs to check blood sugars and administer insulin before other patients, with the exception of any other emergency. This prevents the nurse getting busy and being late. Prevents diabetic patients from late meal consumption, which can be very important with unstable blood sugars. The nurse needs to double check meal trays before passing on to a patient. Nurse needs to promptly begin skin assessment so as not to get busy causing it to be overlooked. Include nail checks in these assessments. They must be thorough, checking between toes and fingers, under any skin folds, coccyx, and heels. Nurse needs to double check that diabetic patients always wear good socks and well-fitting shoes. The nurse needs to double check that when a patient is bathed, that all areas are fully dried, especially under folds and between fingers and toes. Diabetic skin needs hydration to prevent thickening and cracking. The nurse needs to delegate only when necessary, and also have delegatees who double check things. This plan is simple and ensures optimal care for all diabetic residents in long-term care facilities. The plan is proactive instead of reactive. It can prevent many complications in these patients, which include amputations, heart disease, stroke, blindness. This plan can greatly increase a patient's quality of life in these long-term care facilities. This plan of care can include patient input where applicable, which gives a patient a sense of control and a better outlook on life. I've also included my references, and if you will, take my post test. Thank you.